The president is making 500 million at-home COVID tests available for Americans free of charge. But how reliable are they? News 4's Thomas Fleming joins us with details. Thomas.
Jolene, those doctors I spoke to today actually say it's the chance of getting a false negative that's more possible with these tests, and that at-home tests can unintentionally affect the accuracy of statewide and national COVID data.
They're not as sensitive.
OU's Chief COVID Officer Dr. Dale Bratzler says these tests have a little harder time detecting the virus than a standard PCR test, meaning it's possible you get a negative test result but actually do have COVID.
It only detects the virus when the virus is really rapidly growing. So may not be today. You may have early symptoms, but not enough to be detected by the rapid test.
So he's suggesting if you do feel symptoms, wait a couple of days after a negative test and test again.
Read the entire instructions before you do the test.
Oklahoma State Medical Association President Dr. Mary Clark points out that they can also create false results due to user error.
You might feel confident that, hey, I have a negative result, so I'm good, but actually have really a positive test. It was just collected incorrectly.
Both say an unintended issue with these tests is that any testing data is not reported by the State Department of Health.
That's part of the problem.
So Oklahoma's COVID statistics could be off.
There really is no way to do that. That you would effectively have to have someone at home log on to a website and do self-reporting.
The only way to have that positive count towards state data is to get tested again.
I encourage people to go then to the health department or health system and get the PCR test done just to confirm the positive test.
And Dr. Bratzler does say that a study by the companies that make that rapid test shows that it does detect not only the Delta variant, but the Omicron variant as well.